In this video, I'm going to show you how to use the practice dashboard. The practice dashboard includes all patients who have been risk assessed using the See the Signs tool, as well as allowing you to retrospectively add patients. So why use the practice dashboard? Well, the practice dashboard gives you a way of safety netting all patients on cancer pathways, irrespective of whether they are awaiting a simple test like a blood test or a 2-week wait referral. This is an automatic process if you have risk assessed the patient using See the Signs, saving you valuable time. All patient data is also stored in a pseudo-anonymized and safe way according to NHS digital standards. It can be accessed by not only clinicians but also administrators who usually monitor cancer pathways in your practice. This can be particularly beneficial to your CQC assessment as it forms part of their requirements. In order to access the practice dashboard, you first need to launch See the Signs. You can do this by opening a patient's care record and opening the External Views window. Click on See the Signs and launch the tool. You'll first be asked to confirm the patient whose record you have opened. Please click Continue. Next, you will see the home page. Firstly, you'll see the notice board on the left-hand side, giving you the latest news in your area and new features we add to the tool. On the right, you'll see the System and Search button, which allows you to risk assess a patient. And below this, you will see the Practice Dashboard button. Click on the button and you'll be taken there straight away. Here on the Practice Dashboard page, you should first note the tab menu at the top of the screen. The first button will allow you to navigate back to the home screen. Then you have 3 further tabs which represent the 3 main dashboards that you can access. The first is the Active Board. This allows you to see all patients in your practice who are currently on active cancer pathways. The second tab is the Cancer Confirmed Board. This is where all patients who have a cancer diagnosis made will appear. The third and final tab is the Cancer Excluded Board. This is where patients will appear if they undergo investigations or referrals for cancer but do not have a diagnosis of cancer in the end. As I said before, on the Active Board, you'll find patients who have outstanding investigations or referrals. Patients will be automatically added here after their risk assessment using See the Signs. You can also add patients retrospectively, which I will show you how to do shortly. For each patient, you'll see their name, date of birth and age, the referring clinician, the date they were referred on, whether the patient has undergone investigations or referrals. This is demonstrated by the presence of the icon being there or not. And finally, the waiting time, which is calculated from the date referred. For waiting time, the number of days will remain green from 0 to 14 days, then will go amber from 15 to 28 days, and finally will turn red on 29 days or more. This is to help us meet the NHS time standards to ensure patients who are diagnosed with cancer begin treatment as soon as possible. If you click the blue arrow, the patient's record will open. Here you will see a grey box containing the patient's information. First, the date referred with the referring clinician underneath, then the presentation, the working diagnosis or diagnoses, and then the plan elements with a selection button to input the outcome. Underneath is a notes section which is populated by the clinician in the risk assessment part of the tool, or can be edited using the blue pencil. This can be used to note any further steps that should be taken following certain outcomes. As mentioned before, here are all the plan elements for the patient based on the risk assessment. You need to enter the outcome using the selection box here. When you click the button, you will see 4 possible outcomes: cancer suspected, cancer diagnosed, result normal, or other. Cancer suspected should be used when a test, investigation or referral remains inconclusive, such as a shadow on a chest x-ray or a blood test suggestive of leukemia. When you click on this option, you'll see a number of boxes appear. You should first select the cancer type suspected. Then it may be appropriate to refer the patient on to a specialist. So in the notes section here, it advises that a lower GI 2-week wait referral is completed. You can add the referral here. Please note that this does not complete the referral, but will add a new consultation into the practice dashboard so the patient can be monitored and safety netted. You will need to complete the referral independent of seeing the signs. Finally, you can add any other pathology that was noted or any additional comment you may wish to make. Then click Save, and the entry for that particular plan element will be saved. When you add a new referral using the cancer suspected outcome, it will add a new grey box to the patient. For the purposes of the practice dashboard, this is considered a secondary consultation. For this referral, click the Select button under Outcome. And rather than selecting cancer suspected, let's select cancer diagnosed. You should use this option if the cancer has formally been diagnosed. This is usually from a 2-week wait referral. For this option, you will see a different set of boxes to complete. Firstly, you'll be asked to select a cancer type. Then the stage. If you don't know this, select Unknown. The TNM classification, if it has been recorded, and finally any additional comment you wish to make. Then click Save to store it in the dashboard. There are 2 further outcomes. One is Result Normal. This should be used when no abnormality has been discovered. An additional comment may be made if necessary. And finally, Other. This can be used for a myriad of outcomes, including alternative diagnoses, patients who did not attend or refused to attend, or any other outcome you may wish to document. Similarly to the Result Normal outcome, an additional comment may be made here as well. Once all plan elements have been completed, the patient shall be removed from the active board and transferred onto the appropriate secondary board, whether that's cancer confirmed, as in this case, or cancer excluded, if no cancer has been discovered. This entry will be saved into the patient's medical record on EMIS. There are many features you can use to help locate a patient or sort the list according to your needs. These can be found at the top of the screen. First, as I hover over the title bar, you will see buttons appear as I move along the list. You can click on any one of these and the list will order according to the filter. The arrow illustrates the direction of the filter, so click again to reorder in the opposite direction. Alternatively, you can use the Quick Filters menu to perform an advanced search, which includes certain referring clinicians, a date range, certain investigations or referral types, or certain waiting times. If you are looking for the patient in the current view, that's the patient in the blue EMIS bar above, so Mickey Mouse in this case, you can click on the Locate Current Patient button, which is located here. This will find the patient wherever they appear within the practice dashboard, whether active, cancer confirmed, or cancer excluded. If the patient doesn't appear on any of these boards, the button will not be present. If you are looking for a specific patient, you can also search by their NHS number using the search bar here. If you would like to add a patient to the practice dashboard retrospectively because See the Signs was not used to risk assess them, you can click on the Add New Patient button. Please note that if the current patient you have open in EMIS does not exist on the board, you will see Add Current Patient, which will automatically select the patient in the current EMIS view. Select Add New Patient and enter the patient's NHS number. Then click Search. If you add a patient who is already on the practice dashboard, you will see a message pop up in the right corner and the title will change to Add Consultation. Alternatively, if you add a genuinely new patient to the practice dashboard, the title will be Add Patient. Here you will need to fill in the boxes: the referring clinician, the date of the referral, the plans made, which you can select multiple of, enter the presentation, the working diagnosis, and then any additional message for the practice dashboard if required. At the bottom of the screen is a tick box to give you the option of saving the record into the patient's medical record on EMIS, in addition to saving the practice dashboard. Click Save when you are ready to add the patient to the practice dashboard. On the Cancer Confirmed board is a list of all patients who have had a diagnosis of cancer made through the practice dashboard. You will notice a similar layout to the active board with some important differences. Firstly, we have the name and date of birth of the patient, but then you will see time since diagnosis, which again is colour-coded. This is to help you complete the cancer care reviews, which is an important part of QOF. The colours equate to green, 0 to 5 months, amber, 5 to 6 months, and then red for beyond 6 months. And then finally, you'll see the referring clinician. If you click the arrow at the end, you'll see the presentation, the confirmed diagnosis, and the outcome. If you click the blue pencil, you can amend the cancer type, stage, date detected, and TNM classification as more information is supplied to you. In the outcome column, you can add a cancer care review, which will save directly into the patient's notes. Select the date, and then enter the review you have made, and then click Save, which will save the cancer care review directly into the patient's medical record. Thank you for watching this video.